questions if we have time. So understanding peer support and peer mentoring. Peer support involves people with shared experiences coming together to offer understanding, encouragement, and connection. In contrast, peer mentoring provides guidance and support that encourages personal growth, extending beyond shared experiences to foster development. Peer support and mentoring focuses on empowering individuals and building self-reliance rather than relying on clinical treatment. It is important to note that peer mentors are not therapists. They are trained supporters who walk alongside others in their journey. Peer support is grounded in shared lived experiences rather than clinical training, creating space for mutual respect and equality. It fosters emotional connection and collaborative growth, offering an alternative to traditional range models of care. So why is lived experience so important? Authentic connection grows through shared lived experiences, creating space for mutual understanding and validation. These relationships also nurture hope and strengthen resilience, especially within mental health peer support. Benefits of peer support and mentoring for mental health. Peer support offers a safe and welcoming space for individuals to share personal experiences and emotions openly. Through shared understanding, it helps reduce isolation and builds meaningful emotional connections. Promoting healing as a personal journey. Peer mentoring empowers individuals to take ownership of their healing journey with confidence and self-awareness. It offers a non-judgmental support, creating a safe space for open expression and personal growth. Recognizing that healing is unique to each person, mentoring is adapted to meet individuals where they are, supporting progress at their own pace. Recognizing vulnerability as a strength. Embracing vulnerability is an act of courage that allows for genuine self-expression within peer relationships. When individuals share openly, it deepens trust and fosters authentic connections rooted in honesty and empathy. This openness also plays a vital role in challenging mental health stigma, promoting greater awareness, acceptance, and healing. Structure and dynamics of peer mentoring sessions. For typical session formats and activities, participants engage in meaningful activities designed to build rapport, foster positive hobbies, and strengthen coping strategies. These shared experiences create safe, supportive spaces where individuals feel empowered to discuss personal goals, explore plans, and take actionable steps towards their objectives. Active listening without judgment or fixing. Effective peer mentoring begins with attentive listening, giving full focus to the speaker without distraction to truly understand their message. By maintaining a non-judgmental approach, mentors create a safe and trusting space that encourages openness rather than offering unabided solutions. Mentors prioritize validation, ensuring individuals feel heard and supported in their own journey. As a peer mentor, this is the most important thing you do, just letting them know that they are heard and seen. Holding space in shared lived experiences. Mentors foster a safe and supportive environment by being fully present and offering unconditional acceptance. Through sharing their own lived experiences, they build relatability and inspire hope, helping mentees feel seen and less alone. This openness encourages trust, allowing mentees to express themselves honestly and engage in meaningful, vulnerable connections. Expectations, boundaries, and healthy relationships. Establishing and maintaining healthy boundaries. Establishing clear boundaries is essential in peer mentoring as it promotes safety, mutual respect, and emotional well-being for both mentor and mentee. These boundaries help create a stable and supportive environment where growth and trust can flourish. Understanding relationship expectations. Establishing shared goals help mentors and mentees align their efforts toward meaningful outcomes. Recognizing and respecting each other's communication style supports clarity and minimizes misunderstanding. Upholding confidentiality builds trust, encourages openness, and deepens the mentoring relationship. Navigating challenges and building trust. Open and honest communication is key to resolving misunderstandings and building mutual understanding in mentoring relationships. Practicing patience allows mentors and mentees to navigate challenges together, strengthening trust and deepening their connection. For duration, stages, and long-term effect of peer mentoring. The mentoring journey begins with the initiation phase, where trust is built and initial goals are defined. As the relationship progresses into the development phase, mentors and mentees engage more deeply, promoting shared learning and mutual support. In the maturation phase, the connection stabilizes, emphasizing sustained growth and long-term encouragement. Transition and closure of sessions. Mentoring relationships are brought to a close with intention and care, ensuring a respectful and uplifting experience for all involved. Thoughtful closure fosters encouragement and positivity, helping participants feel confident and supported as they continue their mental health journeys independently. Empowering participants as advocates and change makers. Peer mentoring empowers individuals to use their lived experiences to support others, building a strong and compassionate mental health network. Mentors play a vital role in raising awareness, challenging stigma, and fostering open dialogue around mental health. Through this process, participants are encouraged to grow into community leaders who inspire positive change and promote collective well-being. So just to summarize, peer support is rooted in shared lived experiences, offering a foundation for genuine understanding and connection. Through mentoring, individuals build strong emotional bonds that support healing and personal development. These relationships empower participants, strengthening resilience and guiding them toward meaningful growth and lasting change. Questions, Chom?
Michelle did great, right?
Yes.
That is her first time, so she was super nervous. We worked through that though, right? And that's what we do as peer mentors. We work through things, fears and objectives of individuals that we work with. Anybody have any questions?
How does one become a peer, and also is it more like a network of supporting other adults, or you're building?
Most of the individuals we work with come through referral from the state. It's one of those resources that have come up earlier, like the CCS program. Most individuals have a diagnosis or a trauma or some kind of maybe rehabilitation or stuff like that. We usually pair up individuals with providers that have pretty close lived experiences, because lived experience is the key. Because like we say, if you've never been in my shoes, how do you understand, right? So most individuals I work with, they have the same similar lived experiences. So we can build that rapport, which is what's important. Now we guide individuals to their goals and objectives. Most of the people you work with is person-centered, so it's what you want to do, it's not what I want. Everybody knows how to get through their trauma, but they just need somebody to help them advocate for their needs, right? Like, you can tell me that you want to do this, but nobody's listening to you. I could be there like, hey, what's your name again? Chua? Chua's telling me that if we give him this, and if he does this, then he can overcome this. So that's what the most important thing we do is advocacy. Does that answer your question? And we do work with adults and youth and kids too. So,
Progression
we have an agency. We've been started about 4 years. So myself, Chom, and that's my wife, Michelle. We are co-owners of this agency. I've been doing this work for about 6 years with different agencies before we started our own. We wanted to start See Progression to say that we have a Hmong base in peer support, right? We wanted to get more Hmong people involved in mental health, the resources that are available in the community. Because we see that a lot of Hmong youth and adults struggle with these resources, right? Saying that I have mental health issues and I need help. Yeah, we are, okay. Yeah, we are here in Eau Claire, Wisconsin. We contract about 11 different counties in western Wisconsin here. And also with CCS, CLTS, I believe, and we also work directly with some drug court counties that have drug court, or what is it, family court too, with individuals that are going through those struggles in family court stuff. Yes, we do focus on the Hmong population, but it has been hard to get Hmong referrals. I've been doing this about 6 years, and I can say that I only had 2. And I can say both of them were successfully graduated from the program. Anybody? Question?
Do you have to be referred to come to your agency, or can you just like have to come straight to you about being referred?
We had individuals reach out in the past for like direct referrals, but we don't know how to navigate that because most of the referrals come from the county program or through the Medicaid funded program. So we haven't figured that out yet. So most of the people are referred to us through the counties and the cities that we live in.
Chom, what if the other people want to be like active like you guys? What is it that they need to do?
There would be a lot of, they would have to be willing to go through a lot of training, obviously through state. I'm a certified peer specialist, so I've been through some exams and some trainings and stuff like that. But you technically don't have to. I guess like Michael was going through that process, right? So Michael had a referral come in and he's been going through the trainings and all the stuff that we need to get done for the counties to be able to provide, right? Basically, we look for individuals with unique or lived experiences that can bring help to the community, such as Michael, he has substance use recovery. Myself, if you go, I have my own bio in our website. We also have a table over there. It'll show you like my lived experiences and stuff like that.
I just want to say thank you for the work that you do. I'm a healthcare provider, and a lot of my patients who have gone through really, really hard times, some of the best and most influential people in their lives have been their peer specialists who have provided hope and their lived experiences and this life of recovery that they could achieve if they wanted to. And so that's incredible that you guys did this. Thank you.
Thank you. Yeah, so noting what she said, peer specialists also work in a wraparound services too, with therapists alongside with caseworkers and everything. So a lot of our the way we provide or the way I like to provide as individuals unique to the provider, I like to do a lot of outdoor activities with my participants or whatever they like to do. So I guess the great rewarding aspect of my work is learning what they like, right? Because in the past few years, I've learned how to build a PC from one provider, right? I was able to find the resources for us to build a PC together. I learned how to play Magic cards with a kid in the last year and stuff like that, building Legos, it's that mountain biking, I get to experience what they want in their life, because I never had that as a kid, because I guess like my parents are, our family is a first generation home here too. So my parents were here young, I was here young, and we was just both trying to navigate what life was like in this community, right? So it's hard for us to communicate, and the resources wasn't for us there. Like I would say ice fishing as an example. Me growing up, right? We always say, how come we don't do ice fishing stuff? Well, that's why people think, right? Those barriers there, right? Now we can break up those barriers and be like, hey, whatever you want to try, if I don't know how to do it, we'll figure out and we'll try it. We'll do it. I'll give you those experiences so you can find your role in life, right?
What age group do you guys service?
So we do children too. I think the youngest I've worked with was probably like 7, but we also do adults. So the oldest individual I work with now is 57. And he's a re-entry individual. And we've come a long way, so.
Thanks to both of you for sharing how you do. I think it's really important work. I guess my question based on what you're saying is that the purpose, part of
Yes.
So I guess I'm just curious, how or have you been able to identify what the barriers are to why we are unable to serve more?
How I see it is that a lot of the individuals that ask us at our tabling events and stuff is that when we say, well, you have to go through like the county, kid has, or your child might have to get diagnosed with something. So they're like, well, I don't want my kid to be diagnosed with ADHD or stuff like that. Now, well, it's not anything like that. I almost think that can change. Those diagnoses can change. Those are not permanent diagnoses or whatever, because we can build on those and figure out, what it is, right? So I think that is really the barrier that I see is we're afraid to say that, oh, my kid is ADHD, or my kid has, a kind of diagnosis. Maybe child, which parents especially, I feel like the older generation have that barrier too. What's up?
Hey, Chom, I have a two-part question. One is, how do you, you talk about resilience and escaping negative cycles, how would you say are effective ways that you see to teach resilience and breaking out of negative cycles, especially those who bring a lot of negative energy and experiences and trauma? What has been ways that have been effective for you?
I think
My
it's
second question is to Michelle, is where did you get your tattoos done?
I think that the question, from my perspective, is how I see it is it's really rooted in rapport, in like lived experiences. To break those negative patterns and stigmas, you have to walk along somebody that's been through that, for you to be able to help them break it. Because it's not going to work. Because how I see my life is, my mom would tell me that this is the wrong thing to do, well, this is the right thing to do, I won't listen to her. But my parents can tell, my friends can tell me, now jump right on that. So like to break those stigmas, you have to walk with someone that's been through those stigmas and be like, hey man, I've been there too, man. I know exactly how you feel right now, and I can explain. So yeah, I don't know if that kind of answers that.
Story.
Yep.
Share experience.
Yep. Share experiences. Because I've definitely just worked with individuals and and just talk about lived experiences. But you got me and I got you. So that worked, right? I don't know how that worked, but it worked. You never know how things work. It just work. We don't have any female mentors at the moment, but I'm trying to get Michelle to provide. She's always like, I don't have lived experiences. I said, you do. You just don't see them yet. Because I always tell her, like, it's not how bad the lived experience is or how tragic it is to overcome. Hey, the situation is different, but the feelings are the same. So. Oh, I guess we're done. Sorry. But if you guys have any more questions,
Thank you guys so much.